So I'll be discussing about another Chinese trial, another Chinese drug used in the resectable lung cancer. And this is about the RATIONALE-315, which discuss about the event-free survival and overall survival of Neoadjuvant Tislelizumab, which is an anti-PD-1 antibody plus chemotherapy versus adjuvant Tislelizumab in resectable non-small cell lung cancer. So we all know that surgery offers the highest likelihood of cure for patients with resectable early stage NSCLC. However, the 5-year tumor recurrence rates can be as high as 67%. And in recent years, the management of resectable NSCLC has evolved rapidly, with emerging evidence of a clinical benefit of perioperative PD-1, PD-L1 monoclonal antibodies. This trial talks about the use of tislelizumab in this setup. So this was the study design. As we can see, the eligibility criteria first was the resectable stage 2 through 3A NSCLC as per the AGCC 8th edition. Patient should have a performance status of 0 or 1. Patient should be EGFR ALK wild type. They were stratified into based on the histology, squamous versus non-squamous, disease stage, and as well as PD-L1 expression. There were 2 arms randomized in 1:1 fashion. The neoadjuvant phase consisted of 3 to 4 cycles of immunotherapy drug along with a platinum doublet. For squamous, paclitaxel was used, and for non-squamous, pemetrexed was used along with the platinum. The surgery was offered after 3 to 4 cycles, and then adjuvant phase consisted of doing the immunotherapy drug every 6 weekly, 400 milligram along with or a placebo in the comparator arm. The primary endpoints were to look for a major pathological rate by blinded independent pathological review and a EFS by BICR. The key secondary endpoints were to look for the PCR. The other secondary endpoints were OS, EFS by investigator, and the safety. This was the patient disposition. We can see 2 arms, 226 patients were exposed to the immunotherapy drug, though 227 in the placebo arm. Almost all patients received a neoadjuvant treatment in the TIS arm, and almost 99.6 in the neoadjuvant placebo arm. 84% patient did receive the definitive surgery in the immunotherapy arm versus 76. So more patients received surgery in the immunotherapy arm. Along with that, adjuvant TIS was they were able to administer it to almost 75% patient versus 65% in the placebo arm. In the intent, looking at the demographics, we can see the baseline characteristics were matched in both the groups, be it the age of the patient, the sex, the ECOG performance status, the smoking status. As we can see again in this trial, almost 80% of the squamous histology was involved compared to almost 20% of the non-squamous. The nodal status and the PD-L1 expression, they were all matched in both the groups. Again, a significant improvement in the MPR, the major pathological response. We can see a difference of 41.1% favoring the immunotherapy drug. And in the PCR rates as well, we can see a staggering difference of 35%, with almost 40% of PCR were achieved with this help of this drug. Again, talking about the event-free survival, at the 2 years, we can see there is a significant difference between the two curves. 68.3% of EFS in the immunotherapy drug arm versus 51.8 in the placebo arm, and which was statistically significant. Talking about the subset analysis, all subgroups, irrespective of the age, the sex, the performance status, histological type, PD-L1 expression or smoking status, everyone did benefit with the use of addition of this drug to the chemotherapy. Again, talking about the histology, variation response as per the histology, again we can see there is a significant improvement for the EFS for be it the squamous or non-squamous, and I can see the squamous doing better in this population with the help of this drug. Talking about the staging, again both the stage 2 resectable and stage 3A resectable both had an improvement in the EFS at the end of 2 years, as we can see in this chart. About the OS, there was a benefit trend which was observed, and I think as we give more time for the trial to evolve, we'll get the difference a bit more. Talking about the safety was quite manageable. The grade 3 side effects were almost similar in both the subgroups, and there was no new safety signals. Again, talking about the most commonly frequently adverse events were mainly I think was more because of the chemotherapy itself, and they were all quite matching in both the subgroups. Again, obviously, we expect more immune-mediated adverse events in the immunotherapy arm, but then the most common reactions were skin adverse reaction, and very less, that is less than 10% of the patient experience more than grade 3 immune-related adverse events. So they concluded as this trial demonstrated a clinically meaningful and statistically significant benefit of EFS with the perioperative TIS plus neoadjuvant chemotherapy. The MPR and PCR rates were significantly improved with the neoadjuvant immunotherapy drug. The OS benefit trend favoring a perioperative TIS was observed within the interim analysis, and the trial will continue to assess the OS. The safety profile was it was quite well manageable, and taken together the statistically and clinically significant EFS, MPR and PCR benefits and this manageable safety profile, they supported the use of perioperative TIS in this population. So my take would be that trial shows that there is an impressive benefit, particularly in the group of patients with squamous histology. Typically we see that this population is underrepresented, and generally they are less favorable outcomes. There was no significant delay in the surgery. Toxic profile was as expected. Obviously the study is about the Chinese patient, and we should consider having additional data on this. Thank you.